So they have a lot of sensors used for the daily activities. So to monitor the daily activities. So this can be used to monitor the patient's activities with the different devices. Then it can be taken. All the informations will be taken to the uh, kind of storage. So when they are it's taken for the storage, so whenever it's needed, it can be taken for the further actions and all this. So immediately the team can be consulting with the patients and all this. Okay, so this is one example. So this is an infrared motion sensor. It's used. So it's used in the in home, the different room locations and all this. So every moment, so they will be sending the information. So this is one example. Like that, we have several examples. So this can be used kind of different applications point of view. So different sensors you will be using different conditions. So already I told you the measuring the vital signs. Okay, so the measuring the vital signs, monitoring the parameters, what is happening for the period of time and all those things. Okay, so the similarly you can based on the sensors you will be uh, fetching the information. So this can be taken for the further actions in the sense. So the advice can be given, suggestions can be given. Even that's a very good example we can say as a sensor based medication dispenser. Okay, so because so if older elderly people are there, so they sometimes they will forget to take the medicine. So if you are guiding kind of equipment, so it will give you kind of alarm. So morning 8 o'clock they have to take this tablet. Afternoon, so it can give the the tablet also will be filled in that. So in time it will be dispensing to the patients, so that they will take this in time the medications can be handled. So like that, so we have the epilepsy sensors and others. So lot of sensors we are using. So these are all few examples I'm showing here. Okay, so this could be taken further. So when you talk about the telehealth peripherals, so we have like the basic meters, basic equipments, the devices. We can say that. So the BP measurements. So we need to have the monitoring the BP. So nowadays the automated BP measurements monitors are there. So we use the pulse oximeter. Everybody knows about the pulse oximeter right now in the pandemic. So everywhere, if you visit any area in the sense any shopping mall or something in hospital if you're visiting, they'll be checking with your temperature, and they will be checking the pulse oximeter. So what is the saturation level? So that's very very important thing. That so now the pulse oximeter, so it's giving the kind of diagnosis. The temperature measurements, it gives a kind of the range of fevers, what is the body temperatures and all this. So this is very very important. So this all peripherals, it's very important for telehealth, telehealth purpose. So similarly, weighing scales and all those things can be used. Then the blood glucometer, then the spirometers. Okay, so everybody knows about the devices. This is gives the primary data. So the immediate data will be taken from the patients for the further analysis. So the sugar level everywhere, they will be checking if the particular age. So the aged people, the first question they will be asking whether you are diabetic. So for that, you need to have the measurement systems to get that. So the sugar level of the individuals and everything. So similarly, spirometers. So you'll be using to measure the lung volumes. So how much the lung volumes is here when they are inhaling that and exhaling the air and all those things. So how much the volume of air is taken in and out. Okay, that is very important. So this all is required. So this is in the generalized form I'm saying. So it can be little modifications. You can add the few devices more with the telehealth process. But this basic things to be must with that. So when you look for this kind of the telehealth services, what kind of services can be impacted, the local services when you are using. So this when you are having all those things, so this is going to have the benefit. So the reducing the demand of the ambulance service, because if the patient wants to visit for the fever, so if the patient wants to visit for the diabetic conditions, they can monitor the glucose level in home itself, so they can share the information. Based on that doctor will be treating the patients. So this ambulance services, so the demand can be reduced here. So this also will give you the benefit to the patients. So preventing the unnecessary admissions to the hospitals, because so small the say example this pandemic itself, so the government is instructed to several people. So if the if those who are in the severe conditions, they can get admissions to the hospital, otherwise the home isolation kind of like that. So in the home itself, okay, so the residential care will be given. So unnecessary admission to the hospital can be avoided here. So if it is getting some severe conditions, then they will be taking the ambulance services to reach the hospitals and all. Similarly, this already I told you, it can give you the kind of the uh, post discharge. Okay, so if they are discharged from the hospital, so they will be getting as a kind of supporting medications and all those things. So sometimes if the surgery, so if the patient is due to the accident and all those things, if they are admitted in the surgery, then the post rehabilitations and all those things. So the community rehab can be given from the hospital. So there is no need to visit to the hospitals. They can get all the things from the this daily process. Okay, so similarly we are enabling the independence and dignity and choice, so they can choose. So always the elderly people have some kind of to request someone, so they avoid request someone. So that time with this services, they can have the independency, so they can have dignity also, so the choice to choose also. Similarly, they will be uh, getting some kind of confident level, so that they will recover easily. So they have the supporting carers, so this also can be helpful for them. Okay. So when you're using this kind of the services, so definitely we can create the kind of stronger links between the health and the social care. So we are bounding to the people, so healthcare facilities will be provided to them. You understand? So this is the impact. So we are getting it. Okay. So cost of telecare, so any tele services you can say, so the cost is everywhere. You need to give the importance. So how much charge they will be taken, so when they are going for the kind of the treatment, so what kind of packages if they want to go for the in the telecare process, so the every week one visit has to be done. So how the assessment will be taken, so when they are taking the assessment, how this can be considered for the financial things to be done, charges and all those things. Okay, so similarly, the no cost is made to the customers for the standalone equipments and all those things. So standalone will give you kind of you, if you remember the standalone device I was talking on the I think 2 class before. So the standalone device you will be using for the kind of checking for yourself. So you will be checking. When you want to go for the kind of telecare, then the standalone device will fetch all the information through the communication medium to the referral centers. Okay, so so this no cost has to be made for the customers for the standalone equipments and all those things if they are if the identified the listed things. Okay, so very important thing is the cost. So if the cost is comparatively low, uh, the person or patient wants to visit the hospital, if they are performing the telecare, if the cost is reduced, then everybody will be looking for the kind of response towards the telecare, so it can be boosted here. So that's a important note we need to take here. So similarly, you need to understand that the technology, whatever the technology, advanced technology we are taking, it should be the good, it should be the very good support to the system. So the infrastructure should be there. Okay. So the telecare, it's a 20% the technology, 20% of technology, 80% of people. So you are using the technology and people together. We have a telecare. So the lot of applications point of view we can talk to that. That's what I was saying. So even from the disaster, we can use this telecare. Okay. So this telecare must be get into the every point of healthcare facilities. So we can be taken with that. Okay. This telecare also we need to make, that's what I was saying, a lot of applications point of view we can think. So we need to take the kind of dedicated package. So you need to custom made, we can say as a custom made or tailor made to the what is the particular patient needs. Okay, so that's what I was saying. So some patients is required the post surgery, they'll be requiring the kind of rehabilitations. Okay, so post surgery, post this thing. If the a neurosurgeon, so they will be talking to the patients. So the rehabilitation purpose, neuro. If the diabetic patients, so the diet chart should be given. So it should be the customized way. It should be the package has to be there. Okay, so that the unnecessary cost can be avoided. Okay. So similarly, whatever the service you're providing, that it should be reviewed. So whether the patient is required the same service for the entire 1 month or entire the period of 6 months and all those things. So it can be reviewed and it can be adjusted for the necessary actions. If the patient is recovering very fast, so few necessary service can be provided, the remaining services can be avoided. So the review can be done, so that it can be customized. Each and every stage it has to be customized. That's what I'm trying to say here. So the referrals for telecare, so they can use any individual, so they can have the self refer. So caretakers also can refer. Okay, so this all the individual or caretaker. So if you talk about the elderly people, definitely they will be having some kind of caretakers. So this caretakers, example we can say as not only the elderly people. So say example, the child is affected with the child is having autism. Okay, so this autism child need some kind of caretaker. Okay, so this caretaker also can use the telecare mechanism, the methodologies to communicate with the doctors. Okay, so the professional also can refer using the online referral forms and all those things through the website. Okay, so a lot of area we can focus with that. So when you are using this elderly people and kind of the MR child or autism child and all those things. So one more, this is um, this process can be taken for the chronic disease management also. So the disease management. So we know that the period of time it has to be monitored. So we'll be looking for the patients. So what kind of service they require. So we can customize the service to the particular need of the patients. Okay. So we need to have like a so easy access of the system for the individuals, the patients. So the any caretaker who is going to work, who is going to stay with along with the patients. So it should be easy access. Okay. So we can have kind of large number of populations. So we need to manage the population through the integrated database and all those things. So we can have kind of screen and the risk managers and all those things. Okay. So definitely we need to have the very good system. So this system will give you kind of access to the patients. So similarly, it can give the patients and the professionals for the community of care and others. So the professional also, they will be looking for the communities of practice and all those things. So this is the thing you need to take that any system if you are designing it reach to the people. So when you want to reach to the people, definitely you will be looking for the access of the system. Easy access should be there. So the patient's involvement should be there. So when the patient involvement will come volunteer, if you are making that the user friendly, if you are making that customized for their needs has to be fulfilled here. That is very very important. So when you look for the needs and when you're planning for the customizing the design and you're giving all the sophisticated easy access with that, then you require that kind of training. So all the time the training session will be assigned. So they will be taking care of the training as well as the development of the patients as well as the professionals. So don't think that only the patient is required training, even the professionals require the training. So how to use it and all those things. If say example in the market the new software is launched, definitely they will be giving kind of demo how to access the software, how to use the software, how to use that particular device. So this training and development is very very important for the both the patients and the professionals they will be taking. Okay. So they will be looking for the system development. So develop the expert systems. So we'll be looking for what is the patient's level and professional level, as well as what kind of protocols, ICT protocols will be followed, uh, kind of guidelines. So when you are developing a system, you need to follow the guidelines. For example, you can say that the simple toothpaste if you are buying, so that has to be approved by the FDA approval. Why we are looking for the FDA approval? So the guidelines has to be adopted when they are manufacturing the food items and all this. Okay. So when you are looking for some electronics and all those things, so the manufacturer should be certified with some certification, CE certification. So this all has to be there. Then only we can say that this product is very good. Okay, so like that we need to have the clinical governance. So that is depends on the how this the product. So how the good on the evaluations and how this can be used to track the patients. So efficiency has to be there. So clinical governance, everything will come into that. So this all will be very very important for any disease. So this is the example here is given, Parkinson's disease management. So here we have like the network which is going to give the different the units can be connected. So here the patient with the PD. The PD is nothing but the Parkinson's disease. The patients will be connected with the society. The patients will be connected with the neurologist. The patient will be connected with the local area network. The patient will be connected with the care team. So whenever it's required, so then it is connected with the different requirements. Okay, so how this uh, this can be taken if any patient, the patient data is required, the patient is required some attention, immediately the team will be responding to that. Immediately team will be sharing the information, so you can check that. So the neurologist will be communicating to the day resource units. Okay, so sometimes you will be getting as a bi-direction, sometimes you will be getting as a only the unidirection. So the doctors will be giving the instructions to the care team. So the primary care team will be giving the information to their resource unit. Then their resource unit will be sharing with the patients. Okay, so this all will be taken with that. Okay, this is example. So this all the arrows will be indicating the information. So whatever the skills is required, then whatever the care has to be taken whenever the patients require here. Okay, so this is one example it's shown here. So all the information about the patients also will be shared in the Parkinson's disease society. Okay, so this is a kind of sharing the information. So whenever it's emergency situations, it will be reaching to the people. Okay. So this Parkinson's disease support network. So we have like a different websites. So the linked websites. So it can be taken with that. So that's ultimate aim is you are creating a kind of ritual one. So to help the patients. So and the families. So with the healthcare professionals help. So we can support the people those who are affected with the Parkinson's disease and dementia. Because why this is very very important. So each and every condition is very very important. So we need to take a note from here. So how this can be taken, the timely the help is very very important. Yeah. Okay. Say example, already we saw the fall reductions. Okay, so we are using for the elderly people and all those things. So immediately the response will be shared with them. Immediately the emergency situation information will be shared with the caretaker. Emergency situation information will be shared with the children. So immediately they will be reaching the patient home or somewhere in the outside. So it can be taken further clinical services and all. So you need to understand the process. Okay, so how timely it can be taken. Okay, so this all the references it's taken here. Okay, so this can be